Yeah, I think that's a really good question. People are often trying to see what the latest updates are for prostate cancer screening, since that's changing all the time as we get new tests and new technology to look at things. And with COVID, we're trying to minimize how often patients are coming into the healthcare system. Telemedicine is taking off, and we really want to avoid how many invasive procedures that we have to do if they're not truly necessary. So, to step back, I think it's important to keep in mind that for South Asians, the incidence of prostate cancer has traditionally been much lower than it has in Western countries. And a lot of our studies for prostate cancer incidence have come from the United States or from Europe. And we've seen a lot less prostate cancer incidence in India, South Asia, and some of that's attributed to genetics, some of it's attributed to diet, but there's a lot we're still learning about that. But I'll say that a lot of the principles for prostate cancer screening, especially in relation to COVID, I think it is fair to extrapolate from a lot of the studies that we're doing here. I think one important development that I've seen here is to check a baseline PSA early in age. So there's been some really nice studies in Europe showing that if we check a PSA at the age of 40, and if it's less than 1, your risk of dying from prostate cancer in the next 25 years is extremely low. And at least in a Swedish group, that was 0.2%. So I have a lot of family members or relatives, and I even have to think about it myself as I'm getting older. When do we want to start PSA screening? How are we going to do that more efficiently? And I think getting an early baseline PSA is a new development that can be helpful. And the benefit of doing this is that it can decrease how often you have to go into the doctor and keep checking it over time. I think the other big benefit is imaging. So in the old days, we would, if we had concern for prostate cancer, immediately go ahead with a prostate biopsy. And again, with COVID, as we're trying to reduce exposure to the hospital, reduce exposure for infections, I think it's helpful to have imaging that can help avoid doing invasive procedures if they're not necessary.